The one thing you don't say, I remember once having the PowerPoint not working, and I said, does anybody in the room know it? And 12 people came up and started pressing buttons, all of which I knew was wrong. So now if the PowerPoint fails, I just carry on with that. Were we good with you?
Yeah, I've actually just filmed that.
Okay. So I'm just going to show a few slides just to talk a bit about the background in terms of the research, and then I'm going to talk about a small project we did in CAMHS that led to this idea to do the research that Simone did with some of the practitioners here. So the research on fatherhood developed largely by British feminists in the 1970s, and this was groundbreaking research, not just in terms of who they looked at fathers, but they invented whole methodologies for looking at the family. However, more recently, that research has been criticised as being biased towards gender equity issues and the deficit model of fatherhood. And it's interesting, that was from Margaret O'Brien, who was one of those people in the 70s that did the research, and 20 years later looked back. And in part, I think this is connected with the influence of attachment and attachment theory. I'm sure your service is no different to CAMHS, where we talk about attachment a lot. But if you go back to the original formulation of attachment theory, it brought this notion of a primary carer, as if all other carers were much less than this kind of primary carer. And, you know, fathers appeared in, and other carers appeared in those early textbooks in kind of footnotes. Now, attachment theory has changed over time and is much more aware that there are children and adults have multiple attachments, but that notion of primary carer holds on. I mean, I'll talk a bit in a moment about this CAMHS audit project. What we found was on the front sheet of our files, it said details of primary carer, which often meant there was no space to put dad or the auntie or the kind of grandma. So these ideas run through lots of psychological approaches, and this was in the 90s, child psychology was talked about as being gynocentric, as if men didn't kind of quite fit with the norms. And connected with that is the sort of research and practice based on the idea that our model of a parent is a model of a mother. And then when we look at father's parenting, we match it against this model of a mum, and if they don't meet it, then they're failing in some way or need to do more to fit with the mother, rather than thinking about what is our idea about a parent, which mothers might take forward, which fathers might take forward in different ways. And so over the last probably 25 years, 30 years, there's been a move from father deficit models to think about paternal involvement. And paternal involvement was broken down into 3 factors that have been researched quite a lot: engagement, accessibility, and responsibility. So moving on, and just to say, all this is on your handouts, all this information. Think about some of the constraints on fathers. Now, one of the most common findings across all Western settings is that fathers' roles are much more diverse. They're much more likely to differ from father to father than mothering roles, and fathers' roles are much more dependent on context. And what this can do is set up uncertainty for men, in contrast for women, where we have a much clearly defined idea about what is the mothering role, particularly across westernised cultures. We'll come back to that idea of being variability, because if dads are taking on very different roles, how do services pitch according to a dad's role? Because it's going to be much more varied. I think that comes up time and time again. We know that the level of paternal involvement is dependent on the relationship to the mother, which itself can be mediated by other relationships. So I think it's something that was said in our discussion before, this idea of the mum might give out tasks. And so while dads might be more involved, it would be dependent on the tasks being shared by mother. And that could be done explicitly or implicitly. And it's not just gatekeeping, it's gate-kept. So it could be mum having the power and sharing it, or it could be dads using male power in the way that male power operates to get out of certain tasks. So there's a negotiation going on that both would be involved in. The other thing that's happened in this country is quite limited impact of policy changes. So when they brought in parental leave for men, they found it was very, very limited, its take-up, and this assumption, oh, men don't want it. But actually when they did the research into men and paternity leave, they found there was often lots of informal pressures at work. That being around missing a meeting wouldn't be looked on well. So while there was, in theory, the idea to take paternity leave, in practice there were lots of barriers to it. Well, so that wasn't my experience, but then I work in child health, and I think if child support services don't have family-friendly practices, who the hell will? And we've also got the increasing European phenomenon of multiple fatherhood, which I'll mention in a moment. So contemporary fatherhood, most children in the UK have contact with birth fathers. And I don't need to say this to a room of practitioners, but what we know is that the family is not a fixed thing. It's a dynamic process where relationships will shift over time. And this has changed since my parents' generation. So British men are now far less likely to live continuously with their children than their parents' generation. And in this study, Lee began to look at how this multiple fatherhood operates and how fatherhood would change over a course of a father's lifetime. And what they found was that it was a small study, there wasn't a lot of people involved, but a third of fathers came with this pattern. So they were with someone that they didn't live with, who had a child, and then dad would become a biological father living with the mother. Then he would move out, so become NR, non-resident. Then he would form a new relationship in which the mother already had children, so would become a step-parent. And then with that new partner, they would have a biological child, so there'd be step and biological children in the household. So that's dual. This was nearly a third. I think this is a really useful pattern to hold in mind when we're thinking about fatherhood, because increasingly it's important that we distinguish family from household, as father's involvement can extend across multiple households. Now this can create a problem for services. If your initial point of contact after they've come through the front door is seeing somebody at home, then you might not even see father. And then what does that mean in times when you're really busy? Because that means 2 appointments. And then it's like, well, hang on a second, I've only got 20 slots a week. Our service has less workers, we've got higher demand. How does that kind of work? So this brings me on to this CAMHS Fathers project. This wasn't a piece of research, this was a participation project, service user involvement project, where we speak to a particular part of our client group and get their ideas about how our service developed. So it uses quite quick and dirty methods, not like the rigorous stuff that Simone's going to present. So why do participation with fathers? Well, to me, I thought it raises quite an important issue about methodology, because the standard way of doing participation, service user involvement, is that we speak to people that come to our service, find out what they like and then do more of it, find out what they don't like and do less of it. But the problem with that is the people who turn up are mothers. If the things that mothers like could be the very same things that fathers don't like and keep them away. And I think that applies to lots of subgroups. So we were really interested to do some participation with non-attenders. We also have the history of failure in child health and support services to sufficiently engage and involve fathers. And to me, one of the best symbols of this was this game that was developed in the 1990s called Don't Wake Dad. And basically what players have to do, I've got it in the card to bring it in, basically you have to move around the board, and if you land on a 2, you have to press this button twice, and every now and again all of a sudden Dad pops up, and that's when you kind of lose. And to me, this is kind of my image of how often things work in child support services for fathers. So this was our Fathers project. So what we did is we did telephone interviews with 15 dads, and we looked at what they said, and we did a brief theme analysis, and we presented what the fathers had said to 3 staff focus groups. And then we took all that information and took it to our governance group that oversees our work. Sorry, that's this bit here. And then we produced an action plan and a fact sheet for the public. So that leaflet that I hope everyone see, this one, this is how we communicated what we did with the public. Now what you would see at the back of this leaflet was a request for feedback, because inside you've got what fathers said and what we did. But obviously we want to know what mothers, other dads, kids think about what they said. So we put the fact sheet out. The idea is that that would get feedback, and then we'll be able to review the action plan and keep the audit cycle going. So that was the rough idea. Does that kind of make sense as a sort of project summary of what we did? So what did they actually say? So what fathers told us, and you'll see it on the second side of the leaflet. Father said that paternal involvement was dependent on the views of other family members. So this is this kind of gatekeeping thing. So the extent of their involvement might depend on other people. This was brought home to me by Rivka, who I ran this project with, called up a family. Mum answered the phone and Rivka goes, "Hello, I'm from CAMHS. We're doing this father's project. We really want to speak to so-and-so's father." And Mum goes, "Oh yes, I'm the person you need to speak to." And Rivka goes, "Well, we're really interested in Dad's views. That's why we're hoping to speak to fathers." And Mum goes, "Oh, I know what he thinks, so I can tell you this." And then Rivka goes, "Well, it'd be really useful if he was involved." And she goes, "He is involved. He stood next to me. Now, how can I answer your questions?" And to me, that example kind of captures something about this interplay between gatekeeping and kind of being gatekept, and how, in order to access fathers, we may not need to kind of work through others as well. Fathers told us about the importance of flexibility around appointments. Interestingly, they didn't say necessarily evening appointments, which is things other researchers found. They said start and the end of the day is better, so then it doesn't kill my working day that I've got to come back and then go off again. And the one thing, and this is the one thing that non-attenders, fathers said, in contrast to mothers when we've done that work before, is that paternal engagement is mediated by the quality of CAMHS communication. If you're not attending all the time, how much you're involved and included via letters and phone calls becomes really significant. So a couple of examples. Fathers told us where there's familial conflict, non-resident fathers experienced, if they didn't get letters about the contact, that CAMHS were siding with the mum. Unfortunately, before this project, our policy was we send the communication to mum, it's up to mum to pass it on to dad. But if you've got a separation, a divorce, that's really kind of unlikely. The other thing that fathers told us that was unless they were contacted directly or their name was on the letter, it wasn't expected or desired by CAMHS for them to attend. So that personal information has a different meaning. You know, and we went to our standard letters, I'll talk about in a minute. What does it say? Dear parent stroke carer. We're at a position now where that's been shown enough in research that we know that's not going to pull in the dad. Okay, so that's what fathers told us. Then what did our staff say? So our staff were saying father's involvement is really important and we need to be proactive. And in that proactive, what's it saying is that the systems and structures are barriers to fathers. If we're not being proactive, then we're being part of their ongoing kind of exclusion. The next point I thought was really interesting, and what we found was that in the conversation, what would happen is if you start talking too much about dads, like you mentioned in your example, people go, hang on a second, why are we valuing dads over moms? Or the conversation moves, oh, we just need to think about parents, and then somehow dads kind of get forgotten. So the conversation often moves between overvaluing and undervaluing fathers, and that's again one of the challenges, because then it says, well, dads and lads group, well, why aren't you inviting mums?
Can I just ask, do people think father's involvement is more important if the child's a boy? Because dads and lads, but what about dads and daughters?
That wasn't something we asked about in this project directly, and also because these were quite brief discussions, I don't think we've got data on that. But that is an interesting question. Also, we found the challenge to develop clear practice guidelines given the varied constellations of families' relationships. So designing forms that would capture getting the details of everybody without offending certain people. You know, because do we want the form to have an assumption that there would be a dad? You know, we work with a number, it's a small minority of families where there's kind of two mums, and you know, so that's where it gets complicated. Concern regarding administrative procedures and policy, that was a big thing we had to work on and we really needed to change. And lastly, in the 3 focus groups and also in the governance group, there was kind of this edge or awkwardness to the discussion that somehow it was a difficult topic. Now, Rivka and I, our idea, and it was only really a kind of hypothesis really about what this awkwardness was, it's so difficult I can't even say, awkwardness was about, was that perhaps when we talk about fathers, it brings up in people's minds their own fathers, or kind of fathers that they live with, and that would be like an emotional undertone to the conversation. Well, that was our thought, and I'll talk in a moment about how we addressed it. So this was our project action plan, so we thought, right, we need to change policy about who gets letters, saying that we give it to mum and she's got to pass it on isn't good enough. We need to look at our procedures, our records, so we just had the primary carer details, we wanted all carers. We needed to change our standard lessons so we can personalise them. So yes, we made those changes, but actually since 2014 we haven't had a chance to review them. And next, staff training. So we ran staff training on father inclusive practice, really well attended, people engaged with it. but we haven't run it, it's not kind of mandatory. Although one of the things that I was most appreciative of the dads that involved and gave us their views was that during our staff training, we tried to do something about this assumptions that we bring. And so in our training session, we asked people to talk about their experiences of fathers, because we felt that was kind of part of what made it difficult, in just to bring out some stories about fatherhood, so that we could notice our own assumptions, so we don't necessarily just replay them. So that was one thing that we did. Oh look, there's me with my dad and son. Next we did liaison with referrers, and that's kind of continued, because often we weren't getting the details. We monitored paternal access, but again that stopped in 2015 when the next project came along. So I was looking at you, because remember you were saying about your appraisal often mentions fathers.
Yeah, well I put it on there every year, just to, you know.
We also looked at our waiting areas, so having images of father in the waiting areas, having periodicals, which I think meant car and fishing magazines, even though I'm interested in neither, but there we go, that's a different. And also running evening clinics, which only has kind of limited access, but we do have some. Also, some of the things we've been running, we do some woodland days, so we've been running family woodland days at the weekends, and here's some images of fathers that got involved in that. Other developments, after we'd done this project, I was involved in the IAP steering group that Judy was involved with, and so this idea came up to do a project on fathers' use of parenting groups, which we as a service make a lot of referrals and recommendations to, and that's when I linked up with Simone and Linda about looking at practitioners' understanding of barriers. The other thing that it came up was that as part of a men's mental health conference, we started to talk about engaging men, but from different perspectives. And what that experience left me with is that us as family workers can have a significant contribution to promoting men's mental health, because there's men that we will have contact with that would never get near a mental health service. We were just saying in our subgroup before that sometimes when men talk about their children, they will express emotions, they will express vulnerability in a way that they wouldn't on other topics. And I think that's an opportunity to us, whether it's to talk about mental health or signpost men to mental health services. I think there's real opportunities there. So out of this project, we got loads of ideas about what you can do, how you can do it differently. The problem is that these are rarely tested or reviewed, and what we really need is some a much deeper kind of rigorous form of research to give us some ideas about what works in practice. So we're going to move on to looking at the research now. Before we do, I know when I get talking, I get a role that people hear as don't ask questions, but I really would well. Is there anything from our little CAMHS project you wanted to ask or comment on?
Given that this is experience within CAMHS, with young people, families who've been referred to CAMHS to solve a problem with the young person that was being involved with. There's nothing here about trying to identify which parent, irrespective of their gender, is most able to help the child with the problem from which they've been referred.
So we only collected data on a separate question, which is who turned up. And we know that fathers were only involved in about a third of initial assessments, which when you look at the actual national data is a little bit higher than the national data. In terms of who can support, we didn't collect that. My attitude is that any family member with which the young person has a positive relationship, I would really like them to be involved.
Certainly you asked the practitioners and they said that, you know, having fathers involved was very key.
Oh, they thought that was really key, yeah. And that was a service we needed to be proactive.
I was just thinking from a psychiatric point of view, if the young person has a particular mental health or psychiatric issue of some kind, the approach to parenting or the approach to supporting them of one parent might be more likely to help them through that, whereas the approach from a different other parent, maybe because of their own problems or whatever, might be less able. It doesn't seem to be necessarily a mother-father thing. It could be something entirely non-gender related at all, that they're attitude of mind, their previous experience, their own mental health issues, whatever, will be better or worse able to help their child overcome whatever it is they've been referred to you for. So, but that doesn't seem to feature. It seems to be entirely a gender-based understanding of the role of the two parents.
And
Am I making any sense?
Yeah, you're making
No,
sense.
that's
That's one of the
not
problems.
isn't it?
It's one of the problems when you do a father's project, because you're putting it front and centre and asking about it.
Yeah.
I suppose what I would say is, particularly when we first meet with a family, I want to meet with everyone because everyone will have a perspective. And it's those multiple perspectives that allows us to get into the detail and work out what might be helpful kind of going forward.
And the other thing is that whoever, whether a parent is able to support or not able to support, they're still part of the picture. So the child exists within that group. So you almost don't. You want to look at the whole thing, don't you? And it takes a long time to establish that as well. You have to build the relationships. You've got to get people through the door to then find out what's going on in those relationships that would mean that they could help or not. And you'd want to think that everyone could do something to help. You'd want to, or rebalance something. If one person's doing more than the other, that might be part of the problem.
I think one of the things when you see that is a lot of this wasn't reviewed. This was 2013, 2014. How you keep going with this stuff when there's a million service development agendas and. Okay, so out of this came the idea to do the research project. So I'm going to hand it over to Simone, who was the principal researcher that was looking at this question. That's here now. So this just to explain, this shows you that's the slide that we're on, and then the next one is in the top corner. I found that
brilliant.
it's this